This is Weights and Wealth, your one-stop shop for entertaining education on building a stronger body and bank account.
We are not doctors or financial advisors and must warn you this is not medical or investing advice. It is for your entertainment.
All right, we are back with another episode of Weights and Wealth. Nick and I are kind of excited about this one, and we do have our naturopathic doctor in training producing this episode, so we might get a comment here or there.
Mm-hmm. Feel free to jump in, Katie.
This episode shout out goes out to Katie and Alex, who have both been helping us produce these episodes with all the camera issues. So big shout out to my sister and my fiance for helping us out here.
Mm-hmm. Yeah, we are replacing these cameras tomorrow.
Yeah, one of the cameras is currently sitting on an ice pack because it keeps overheating and shutting off. So Weights and Wealth is having some technology issues between the hard drive and these cameras. We have been struggling.
Yes.
So if you're an IT kind of person and you know how to edit, please reach out to us.
Please. Because I don't want to learn how to do it, and I might have to. Today's wealth wisdom of the week is to pay attention to marketing gimmicks. The wonderful world of advertising is filled with half-truths, and that's being generous. So just watch out for things like, gluten-free on something that doesn't contain any gluten. Or like that, okay, obviously it doesn't, but that
like
would
a candle.
Never.
Why does a candle have to be gluten-free?
Yes.
You shouldn't be eating candles.
Or throw in like vegan on celery. I've never seen that, but I could see that happening. So stuff like that. And those are obvious examples, but they do a good job of tricking people into buying something.
I mean, if someone is using their physique to market a supplement to you and their entire thing is based about how they've never touched the stuff when they're speaking about steroids. There's a throwback right here. Mm-hmm. Liver King, like, come on. This is like obvious marketing. I don't want to say scam, but like it almost is a scam when these different companies are being so untruthful, right? So we did go over in one of the recent episodes about how the FDA guidelines can allow companies to drastically understate the amount of calories that are in foods, or how restaurants have huge errors in the number of calories they say are in their foods. So be careful of marketing. Realize that with every marketing campaign, there's probably not 100% truth, unless that is a Weights and Wealth marketing campaign. We would never lie to our listeners.
No, we would not, which is why I came out about my reading ability the other day.
Maybe not ability.
Not ability. Yes, that was a poor word choice. Yes, I am literate.
All right, should I jump into the today's article?
Yes.
All right. This was a very, very interesting study I came across. So if you are a short king that has always wanted to be taller, maybe you've looked at surgeries that you can do to make you grow a couple inches. Well, maybe there's nothing you can do for yourself, but maybe there's something you can do for your kids. All right. So this study, I guess I should explain some statistics first real quick so that people understand what I'm saying for anyone that hasn't taken a statistics class. Basically, R is a correlation coefficient. So if you look at a scatter plot and there's a line on the scatter plot amongst all the dots, there's a value called R that basically measures how close all the dots are to the line, right? So it measures how much something correlates to an equation that is made. So if there's a R value closer to 0, it means there's not a very good correlation. If there is an R value closer to 1, it means it's an extremely high correlation, and you can bet that there's some real, I guess I don't want to say causation, because not every study that looks at correlation has causation in it, but it's a much better determiner of how strong that relationship is.
Yeah. So for example, something with a high R value, if you look at powerlifters and the amount of weight they lift and how much they weigh, those will be very tightly correlated. So that would be an R value close to 1. Is that correct?
Yeah. It might be like a 0.9 R value. There will be some outliers that take the R down a little bit as you get some dots that are further away from the line. But that's basically how R, or correlation coefficient, works. And then also the other thing to hit on real quick before we get into the study is confounding variables. So confounding variables are essentially a third variable. If you look at a graph, there's an X and a Y axis, right? So there's two variables that you're measuring against each other. A confounding variable is a third variable that's not on the graph, but that is impacting both of those variables, right?
Yeah, in statistics, they call this randomness. Like it's something that you can't explain. So I don't know if we want to go to the wage gap, but that is something that has a lot of variables in it, and it's not just the sex of the person. There are many other variables.
How much time they've taken off of work or their career to raise children, for example, would be a confounding variable in like gender and pay.
Yeah,
right? So,
or the field you go into. There are many variables that often explain one outcome.
Yeah, so for a lot of nutrition studies, there will be what's called a healthy user bias, where it might measure like the amount of meat someone eats and then some sort of disease. But then if you look at over the past 40 years, we've been told to avoid animal fat and that red meat will kill you. Now the people that are trying to be healthy and that have other healthy behaviors, such as physical activity and maybe avoiding smoking or alcohol, those same people that are engaging in other healthy behaviors are probably going to limit their red meat intake. So now there's a healthy user bias. That's a third outside variable that's affecting the variables that are being studied. All right. So
did you know that I almost switched my major to statistics after I took my intro classes?
Really?
Love it.
I never knew that.
Used heavily in economics, and so those two together I really enjoyed. But yeah, but it's a whole different school, so none of my prereqs would have transferred. It's a science.
Yeah.
So
and you didn't really come into the science building much.
I did not. I took a physics class there that was easier than my high school physics, and it wasn't even honors. It was like your baseline.
I remember that class because we compared it to the engineering physics class, and you guys were literally using 10 for gravity, right? Instead of 9.81 meters per second squared. You guys were using 10, rounding up.
Yeah. It was something. Whereas my high school physics class, we used the actual
9.81 meters per second squared.
Yeah.
All right, back to the study. So basically, there's 152 countries looked at in this study, and you can basically just draw a straight line between the amount of red meat and dairy that a country consumes and the height of its male population. So when I first saw this study, I was thinking, okay, there must be a confounding variable that's affecting this, right? Wealthier countries probably have more access per capita to red meat, right? If you think of like poorer countries and a poor population, you probably think they're being sustained on like rice and really cheap crops and not able to get meat, right?
Yes, yeah, and this doesn't consider grass-fed versus organic, right? Because the actual nutrient content is the same between grass-fed and non-grass-fed,
yeah.
But you get a lot of other crap with non-grass-fed.
Yes, so I thought that like GDP or wealth of a nation was probably a confounding variable that explained this, but as I got deeper into the study, they actually also compared GDP per capita, healthcare expenditure, and some other things. And those R values were much weaker than just the correlation between the amount of what they called like quality animal protein in the diet. All right. So if you look at male height compared to GDP per capita, the R value for all of these countries was 0.39. which is not a very strong R value. That means it's not a strong correlation. If you look at male height compared to health expenditure per capita, the R value was 0.54. Still not a strong correlation. And then lastly, if you looked at male height compared to the amount of protein consumed from dairy, pork, eggs, and potatoes, the R value is 0.79. Pretty strong R value. So The only other variable that I could think of to explain this that would deviate from just the protein quality and the amount of protein, the grams per day that people were consuming, was genetics, right?
Yeah,
Because
I was
genetics
just
have a
thinking
huge
that.
role. But when you look at all the countries, the Western Balkans produce a lot of really tall people. And
Is that like the Nordic countries?
no, Western Balkans is like around Greece, like the Balkan Sea, right?
Okay.
So
Okay,
Czechoslovakia,
yeah, that would make sense.
So countries around there, but they do not have the something on the X chromosome that makes some guys taller. They're missing that gene for height.
Okay.
So the study was saying like, because they don't have that throws off like the correlation of just looking at that one gene compared to height, and that being the explanation behind it.
Okay, I kind of wonder what you would see if you chart like individual countries as red meat consumption goes up, if height goes up, and if you compare all those, like say the change in the last 100 years, X company's meat consumption has doubled, and see how much they've grown compared to a country that has stayed the same or gone down. I wonder if we could find the data on that.
Yeah, I don't know if they have data like going back over time like that, but that'd be interesting to see if they did. But I mean, the correlation here is very strong for the more meat, dairy, and eggs that a country's eating, the taller their people are. So I thought it was very interesting. And then the study also went into there were some negative R values, which means a negative correlation, which means the more of that thing that they analyzed. So in this case, for food, the more of a certain food that a country's people ate, the shorter they were. So, or the less tall, right? So for this negative R value, the big one was the more rice, corn, and beans a country ate, the less tall their people were. So very, very interesting study, I thought. And
Yeah.
if you want your kids to be tall, feed them a lot of dairy, meat, eggs, and potatoes, I guess.
Which, like, the way I'm kind of reading that is I don't think that would make you short, but that's something people would eat a lot of if they don't have protein.
That is
that
also
makes
possible.
sense.
Yeah.
So
Yeah.
if you are eating those things, I probably wouldn't worry about
Probably eating less meat. Yeah.
it. Yeah. I wouldn't worry about it so long as you're also eating meat and
Yeah.
you want to be tall. So, okay, shall we dive into the meat of this podcast?
So someone said earlier, every time we actually have a good transition, we ruin it by pointing at.
Yes.
All right, Nick, you want to go first?
Sure. So we have a graph that Ted will put on the video and in the show notes, but it essentially graphs the cost of healthcare in a bunch of different countries. And the U.S. is just over $12,000, I'm thinking, per capita.
Yeah, this is per capita, and this includes government and out-of-pocket spending. So if you look at like the statistics we'll talk about here real quick are going to be slightly different than if you pulled up a government spending per capita, because like for the U.S. it's closer to $10,000. But yeah, here you've got the U.S. above $12,000 per capita in healthcare spending, and then the next highest country is just under, what is that, 8,000? Yeah, it looks like about
Germany.
7,500, right? So basically all these countries, if you're watching the video, you can see. If you're just listening, I'm going to describe it real quick. But basically there's this like shallow, linear almost increase from like less industrialized countries up to more industrialized countries. And then after that shallow line with all these countries, there's the U.S., which is just like way above everyone else in spending, which is not a metric you want to win.
Right. Yeah. Yeah. And I mean, the U.S. does spend more than a lot of countries in a lot of different areas. And I think one of these reasons is just the cost of living, that we make a lot more money per GDP. So we have a higher cost of living. We have to pay doctors, nurses, pharmaceutical companies, insurance companies, all these people that are making a living based on the healthcare system. So you have to charge more because otherwise these people wouldn't be able to sustain themselves.
You're saying we should just get rid of all insurance companies?
No, I think insurance should be expanded. I think you can do a lot more with private insurance than is currently being done. I had this one idea. I don't remember it right now, but I thought it was genius. And if I think of it, I will mention it. But like FDIC, that could be privatized, no problem.
All right. So basically, with this graph, as Nick pointed out, the cost of living increases in all these countries, but then it still doesn't explain the rapid jump for the U.S. Being more expensive. So, Nick, why is it that healthcare in the U.S. is so overpriced?
So I did just mention cost of living, but like Germany, Switzerland, Norway, Netherlands are all right behind us. I think Switzerland has more GDP per capita, so that doesn't explain that at all. I think part of the reason, so pharmaceuticals are but somewhere around 10-20% of the total healthcare cost. And since they have patents in America and get their monopolistic pricing, they can charge pretty much whatever they want for 10 years or so. Whereas other countries have price ceilings, right? So they have to make their profit in America. If they have a specific profit goal and they can only profit, $5 a pill in Germany, and their goal is $10 a pill, they have to make up the other $5 somewhere. And since the U.S. doesn't have price caps on pharmaceutical drugs, they can charge whatever they want. So it's a really tricky issue to solve. But one idea I have is to either lessen patents or get rid of them, because in a monopolistic pricing model, say you can make $5 profit selling to 10 people, you make $50, right? Or you can make $200 profit selling to one person. And the way that supply and demand charts go, especially when there's no competition, that happens often, where you can make more profit by only selling to one person versus selling to 10 people.
Yeah. Well, and so what Nick was saying with other countries having these price blocks on the drug prices, this gets into a situation that's very similar to how we spend with our military, right? So with our military, we've become the police of the world and the protectors of the world, right? Europe doesn't contribute as much as the U.S. does if there's a large war, right? We spend a lot more money. So because we've taken on that role, we spend more money on the military. Same thing happens with drugs. The U.S. is the big innovation center for medicine, right? So these companies, in order to spend the money that they do on research for new drugs, they have to make money to spend money on that research. And so if you want these American companies to keep innovating, they have to be able to charge more for drugs, right? So then it just becomes this kind of separate thing from the rest of the world where we're the ones innovating, but because of that, everything is more expensive.
Right. And investing in a pharmaceutical company is very risky. If you look at the top movers of the day, there's often a pharmaceutical company on there, because if they come out with a new drug or have a breakthrough, it's going to double or triple, just because of the profit that can be made from that. And there is a lot of money in big pharma. They make a lot, as do insurance companies, which is another piece of the puzzle. I guess when people aren't spending their own money, they don't care about how much they spend, really. And so if somebody's going to get an operation and it's going to be 100% covered by insurance, they're going to probably spend the most so they can get the best care, which is good, but it also jacks the price up a lot.
Yeah, there's also the problem where if you don't actually see the cost of anything and you go to the hospital, they can pretty much just charge whatever they want for little end items that they use in treatment or during your stay. And so a lot of times people will go to the hospital and then they'll call regarding the bill and they'll get it reduced heavily because there's all these like extraneous charges and stuff that's the price is way inflated for because the hospital just bills the insurance company.
Right.
So it doesn't really matter.
Yeah.
As long as the insurance company picks it up. And so it's kind of just this Ponzi scheme. Sorry.
Right. Oh no, that's all right. And I mean, and insurance companies do have like deals with hospitals. That's why you have in-network and out-network.
Yep.
So they automatically get a discounted rate, whereas an individual has to do more haggling. And you can haggle. Like we were talking the other day, buying your guys' furniture when you were at work, that there's not really haggling in the U.S., but you can with healthcare.
Yeah.
That's why it's always recommended to ask for like an itemized bill.
Yep.
Because then they have to list out every charge and tell you that they're charging you $100 for ibuprofen.
And then you can be like, I don't think ibuprofen is worth $100.
Yeah.
Why is this Band-Aid $20?
Yes, exactly.
And they're not going to sit there and actually tell you that it costs that much, so then your bill gets reduced.
Yeah. So who do you think spends too much on items, the government or a hospital? I don't actually know
weighs
this.
more?
Yeah, who weighs
no
more? Because
it's got to be the government.
What's it, $400 toilet paper or something like that? I don't know. So yeah, insurance companies are also a big part of why we have such high healthcare costs. I think that high deductible plans help with that a lot. And I think they should be more encouraged because you're incurring more of the cost. So it makes you think twice about it. And a lot of people view insurance as like, I pay my monthly premium and they should pay for everything.
Everything, yeah.
It's insurance. It's for like catastrophic events. Like if you get cancer, it'll cover, beyond, say your deductible's $10,000. It'll cover everything over that. Now you might have problems actually getting them to do that. That's another discussion.
The problem is we've moved to a place now where like health insurance is just supposed to cover everything, everything to do with your health. And I guess we can move on to the lifestyle aspect of this.
I did have a couple more points I want to make.
Okay.
That I know we talked about it with Katie, like a lot of doctor's offices are starting to not accept insurance, which I think is a great movement, and that'll really bring the cost down. There's one, I believe, in somewhere in like the middle of the country, Nebraska or something like that, where they are doing very well and they have very good medicine, and people are coming from other countries like Canada because they have huge lines to see doctors.
Yeah.
They're coming there because they have lower costs, because they don't accept insurance, and they provide great treatment still.
Mm-hmm. Yeah, I think the anti-insurance model is definitely going to be growing in the next 10 years because the inflation of prices that has just occurred under these not monopolistic, but nearly what is it called when there's a few companies that control everything?
Like an oligopoly, I think.
Yeah, oligopoly. I mean, like you can see even just in like your city, there's like a healthcare network that has taken over all the hospitals, right? Like there's these insurance companies now control every hospital in the area and all the doctor's offices too. And like in Rochester, was it U of R that basically controlled everything? Like I remember when we were growing up, it wasn't like that. But then every year it was like, okay, now this doctor's office is also through U of R, and everything just became under one system, and then there's no competition.
Right. And I believe it's often the case that a hospital has to approve another hospital in a city to be built.
Okay.
Now hospitals are not for profits, but I don't know for sure, but I've heard their accounting is very like finicky and different from other not-for-profits, so they can retain that status. Something to do with them having to treat anybody that comes in the door.
Okay.
So they take huge losses on that. But that pretty much makes that's a huge barrier to entry, because if you are profiting off a hospital, why would you want another one?
Yeah. Why would you want competition if you're already winning?
Right. Exactly. Yeah.
All right. Do you have anything more about insurance companies before we move on to lifestyle?
No, I think that was it.
All right. So what Nick and I were saying with health insurance now being used to cover every aspect of your health instead of just emergencies where you need something because something catastrophic has happened. Like now people don't really respect their health and their bodies as far as just like their daily habits and lifestyles. A common thing that people will say on this topic is like, when I go to the grocery store and I see other people's carts, like it doesn't make sense that I have to pay the same amount in health insurance as they do, right? Because if you're spending your hard-earned money on Whole Foods and being healthy, and then you see the person in the grocery store that's literally just got Pepsi and Mountain Dew and frozen pizzas and everything from the center aisles. Like it doesn't make sense that you're basically paying the same amount in healthcare, right?
Yeah, and health insurance is also different from other insurances in this regard. Like if you get life insurance, somebody's coming to your house and checking up on your habits. I think they will test to see if you have nicotine in your blood. Like they do this very thorough analysis. But with health insurance, there's all these pre-existing condition rules, and they can't really tailor it. They can't tailor your premium to your lifestyle as much as like driving. Also, you've been pulled over, your insurance is going to be way higher.
Yeah.
Health insurance, that's not really the case.
Okay. Yeah. So, I mean, it sounds like people are just like complaining and being rude sometimes when people point out that grocery store thing, but there's definitely a lot of validity to it. And just because of how much diet does impact your health, I think a lot of people just don't realize how much diet impacts their health. So they don't understand that all their medical bills are stemming from these basic habits, right?
Yeah.
And so I think that's one of the reasons why healthcare is so expensive in America is, chronic disease. We've got some statistics here on chronic disease, so we can go over that. But a review from 2012 showed that 40% of deaths could be prevented from some simple lifestyle changes. And then a 2020 study found that 90% of diabetes, 80% of cardiovascular disease, 70% of cardiovascular mortality, and 50% of cancer mortality were attributable to not following a low-risk lifestyle. And so I looked deeper into the study to see like what the lifestyle was. It was nothing that severe. It was like basically taking care of yourself, right? So the 5 lifestyle factors they used were diet, and the metric they used was not even that great of a metric if you look at what we would consider a good diet, but it was just like slightly more whole food based than like the average American diet. And then the data was also striated by the amount you smoke a day. The exercise was one of the 5 lifestyle factors, and it was just whether or not you get at least 30 minutes daily. When you look at hours per week of exercise, so basically if you're getting at least 3.5 hours of activity a week, which doesn't even meet the guidelines. And then alcohol was the 4th one, and that was for grams a day of alcohol. So it basically striates 0, 1, or 2 drinks a day as being healthy, and over that as being not healthy. And then the 5th metric was BMI, being between 18.5 and 24.9. And we've talked before about how BMI isn't a very great statistic because it doesn't take body composition into account at all. But at least that gets rid of severely obese people into that unhealthy column. But like these 5 metrics, it's not asking for a lot. Like some of these aren't even meeting the basic recommendations, right? So,
yeah, and like those 5 things are all things that a life insurance company could look at when setting a premium. And I would think that healthcare premiums could be set very similarly to life insurance, but they're not. So,
yeah, and I mean, when you look at chronic disease in this country, like it's not hard to do these things. And I think COVID helped people understand a little bit better how to take care of themselves, but like still, like these are not hard things for people to do. But here we are, and then people wonder why healthcare is so expensive, and it's like, okay, well, if everybody is sick, then it's going to be expensive. So.
Right. Yeah. Okay, and then people also like to the big comparison is Europe and America, right? That Europeans have lower healthcare than Americans do. I also think that Americans tend to be a lot less healthy than Europeans. So it could also just be the case that since we are less healthy, we require more medical care, and that's why we're paying more per capita. Like, and I would venture a guess that that is part of that equation we talked about, that tries to find exactly what is causing an outcome. And then there's the talk that Europe has banned substances that are allowed in America. It does work both ways. There are banned substances in America that are allowed in Europe. What those are, I don't really know, but that could always contribute to it as well. And there's also the argument of, should a government even ban substances, which I think they should. But
yeah, I mean, even just like the use of GMOs and pesticides in America is a lot more than that of Europe. And I feel like we are starting to see the general consensus turn around on GMOs and spraying all your food with Roundup. But like, I mean, that's done a lot of damage, especially to people's gut health over the years. And I mean, most of disease starts in the gut. Was it Hippocrates or someone? Do you know, Katie, the famous quote? It was someone from like ancient Greek medicine, I think, that said like most of disease starts in the gut, basically. And as we learn more about gut health, we realize that that is true. So if you're nuking your gut with antibiotics and pesticides, like you can expect to not be healthy. So
okay, and I know we already hit on patents a little bit, but I'm reading my notes now, and there are a couple other things that I want to point out. Kind of for our Freedom F, intellectual property is something that's been debated over and whether it really exists. And I think in some cases it does with like music. Like if you buy a song from an artist, you shouldn't be able to resell it, that kind of thing. But if somebody patents a drug and I buy it, why can't I reverse engineer it and start selling it? You're in the same breath telling me that I can't do something with my own physical property that I have. Do you get what I'm saying?
I don't know. I think I would support like people having patents on, I don't know. Because they expire. Like, what is it, 10 years? Like,
I think so.
It just allows the company to make money off the investment they made in like discovering.
They could also have each person who purchases the product sign a contract saying they won't reverse engineer it and go through legal proceedings like everyday Americans have to. So that's another solution that would take place if patents cease to exist. And the main argument is not to do away with patents, but the number of years that they get.
Yeah.
Because 10 years is a lot to charge whatever you want.
Yeah.
Especially with insurance companies paying for it. Because like we said, it's like the perfect storm that with insurance companies, they'll pay pretty much whatever they're asking. And if it's covered, people will receive that drug.
Yeah.
Do you want to go on to Medicare for all?
Why don't you take it away?
You start it. Okay.
Go for it.
So this has been a push, especially among the Bernie Sanders-esque people, to cover everybody. And this kind of goes back to the argument of, if I'm living well and want lower healthcare costs, why should I pay for everybody else's? And then we get into problems of having to wait for doctors longer, not as much innovation if we're paying less. Because also, if the U.S. went to this, what are the pharma companies going to do that can't profit really anywhere now? Because I mean, I'm sure there are European countries that have a similar model to ours where they allow companies to charge whatever they want, but there are also a lot that don't. My own personal opinion is that I think, which this is hard to break out, any genetic issue that you're born with should be covered because you have no control over that. But then there's also the case where, if a kid is fed crap for 18 years, they're probably going to have complications later in life, even if they do a 180 with their diet.
Yeah.
As soon as they turn 18.
I can break that real quick. Ready?
Yeah.
All right. So, you know how some people have been saying that obesity is genetic, even though we know that that's not really the case. All All right. So now if obesity is genetic and all these chronic diseases stem from the fact that I'm obese, well, now all of my healthcare stems from my obesity that is of genetic means. So.
Yeah. But I guess we get into the debate of whether obesity is genetic or not. And if you go back and look at pictures from 100 years ago, I don't think it is.
But people make that argument today.
They do.
So.
But I mean, that's, in my opinion, a frivolous argument. I think any logical person would agree with that, but maybe
I think
not.
Any logical person also wouldn't wear a mask in their car alone. But we've been there.
This is true. Which, I mean, I'm sure it's genetic with some people, but I think it's not the 50% that America has. I don't think that's all genetic. But I was thinking things more along the lines of like, is it type 1 diabetes?
Mm-hmm. Type 1 diabetes.
If you're anemic, I'm pretty sure that is no.
Well, because anemic is just from like a long-term deficiency.
Okay. But anything that if you're
unless you're thinking like sickle cell anemia.
Yes, that's what I'm thinking of. Yeah. So stuff like that I think should be covered because it's not that person's fault for receiving that disease. That's just luck of the draw, bad luck, essentially.
Or good luck.
Have
you heard that before? All right, so sickle cell anemia actually protects you. What is it, Katie? Do you know this? In Africa, it protects you from malaria.
Yeah, it protects you from getting malaria. So it's basically a genetic adaptation.
Yeah.
That's why it's like not a thing in people of like European descent. It's present in people of African descent.
Yeah.
Okay.
So, I mean, I guess it depends on how you look at it, right?
Yeah. And I'm actually going to shout out my buddy Tyler Ross, who I used to work with on this, because he was the one that convinced me that conditions you're born with, because he pointed that out when I told him I didn't like Medicare for all. so stuff like that.
Yeah, I mean, I can definitely see that kind of an argument. I mean, the government pays for like disability, right? So is like that's not that much different than that, right?
And with 80% of disease being preventable, that we're only talking really about the other 20%, probably not even, because a lot of people like that happens along the way.
Yeah, that 80% statistic comes from that 2020 study I mentioned that had that 5 metrics. They determined about 80% of chronic disease is preventable through some basic lifestyle changes. So a big portion of healthcare costs in America go towards those chronic diseases that are easily preventable. So if we could just get America to be healthier, we could probably bring down healthcare costs quite a bit. Because also, if you have less people that are like ballooning the system, you have a lot less people working in the system on like the paperwork and bureaucracy and insurance side of things, right? So if you can get America healthier and get these chronic disease rates to go down quite a bit, then you would save a lot of money on healthcare.
Yes, yeah. And then also Ted and I are doing a series on education. And we like the Socratic method a lot, so I'm just going to pose a question to the audience,
right.
Which the Socratic method has unanswerable questions, essentially. So what's a human life worth? Like, is it worth paying $1 trillion to save one person? I think most people would say no to that. Is it worth 1 penny? Most people would say yes. So it's finding the middle ground. So a fun exercise to do is to try to find an answer and explain why.
Yeah, and this is where you get into a discussion of, even though we do pay a lot for healthcare in America, it is better in some ways than other countries, right? Nick mentioned earlier how if you're in Canada, if you break your arm in a car accident, guess what? You're waiting 8 weeks to get a cast on that thing.
Yeah.
So in some countries, they have really long wait times. I know there's a lot of articles that have come out in the past few years about the UK basically deciding who lives and who dies because it's not up to you, the civilian. It's up to basically the government to decide who gets what healthcare. So basically every healthcare system is going to have disadvantages. And unfortunately for America, ours currently is that it is super expensive, but there are some advantages, including more freedom of choice and also that we are the innovation center of the world, really.
Yeah. Did you know about? I think there was a kid, a young child in Britain whose parents wanted to take him to America to get a surgery done to save his life, and they blocked him from leaving.
I remember that article. Yeah.
Yeah.
That was,
Like that's just insane. So, I mean, in one breath, you can say that America spends way too much on health insurance, but you could also say that we care about life more because we are spending more on it. Like we allocate more resources to keeping people alive.
We win.
So, yeah, I think that's everything.
Yeah, you've gotten the notes here. I guess we can just end with this. The bottom line is you can't expect healthcare costs to come down if the government is creating a large bureaucracy system and if people continue to choose to be so unhealthy. So I think we can just end this with maybe encouraging people to make better choices and to get healthy themselves. Because at the end of the day, as long as obesity keeps going up, chronic disease is going to keep going up, and healthcare costs are going to keep going up. So it's really on us, the people, to get healthier, right?
Mm-hmm. Yeah.
All right. Thanks, guys, for listening. If you have any questions or comments on things we said, let us know. We'd love to continue the conversation in the comments on YouTube or on social media.
Mm-hmm. Yep. Thank you. Thanks for joining us today at Weights and Wealth. And don't forget to apply today's lessons to live healthy and wealthy.
If this conversation will contribute to your fitness and financial gains, please share it with a friend or family member and give a 5-star review so more people can lift bigger weights and get bigger bank accounts.